Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and today is World Heart Day. And every year, September 29th, this is World Heart Day. And there's a lot of course, first of all, I'll start by saying that cardiovascular disease is the number one killer in the United States. And this is actually becoming true and common in many countries, including low and middle income countries. And so today is kind of bringing awareness to some of the risk factors that are out there. And of course, me personally, I have risk factors for heart disease, and I know of others that have similar problems. So some of the areas, this is actually the official website for World Heart Day. So you can understand the risks. So make sure you know all your health numbers. That's something important. I mean, we live in the 21st century. Before, there really wasn't even an understanding until the 50s, really, that cardiovascular disease, high blood pressure, eventually leads to cardiovascular disease. One of my favorite risk scoring systems is the Framingham risk score. There's other risk scoring systems that you could be looking for. If you type in risk scoring under Google, cardiovascular risk scoring, you can see that where they're available. Now, one that I would really recommend is QRISK2 or QRISK2, and this is actually a source from the British system, and I'm not sure why they didn't adopt that in the United States. Probably because we always do things much later than European countries. But that's another observation for some other day that we can go over. Risk factors associated with coronary heart disease and stroke, family history, of course, that cannot be modified. Risk factors such as blood pressure, that can be modified with treatment. And of course, a lot of people, including me, are on antihypertensives or blood pressure lowering medications. Diabetes is a major global threat. 425 million people in the world have it, 1 in 11 adults. This is a serious problem, and that, of course, as we know, leads to cardiovascular disease. Physical inactivity, another problem. 150 minutes of moderate physical activity per week reduces the risk of cardiovascular disease by 30% and risk of diabetes by 27%. So physical activity is very important. Now, cholesterol is raised cholesterol is estimated to cause 2.6 million deaths and is implicated in heart disease and stroke. So, of course, a lot of the statins that you probably know about are applied here. Many different types of statins are rosuvastatin, simvastatin, lovastatin. All of these are available to lower cholesterol. Now, there are multiple alternative medicine routes that I would necessarily not recommend, but with diabetes, you have chromium picolinate and cinnamon that you could possibly take every single day. Now, this is not recommended for people who already have diabetes. Again, this does not replace medical advice either, but there are some studies that have shown that there's an association between lowering diabetes and some of these herbal medications. Of course, tobacco, that's a no-brainer. If you smoke, if you currently smoke every single day or frequently, then there is help now that wasn't available many years ago, that when I was in medical school. Not as frequently readily accessible. So, of course, you have the nicotine patch, the nicotine gum, and some people actually make modifications according to their personal needs in terms of helping to quit. So that, in a nutshell, I mean, one thing to keep in mind is that certain aspects like a visual and minimal writing is something that is really important because health literacy is a very prominent area, and so people that have lower education or understanding of medical knowledge are able to actually understand these in a more concrete manner. I think what really interests me is diabetes, so we can click on that and take a look. Again, there's a minimum of these have most of this has already been presented. 425 million people, with the overall figure predicted to rise by 629 million by 2045. Again, that's a very important figure. Type 2 diabetes accounts for approximately 90% of all people with diabetes. All of those living with diabetes are at heightened risk of CVD, making the prevention of CVD onset a major priority. Diabetes damages your blood vessels. People with diabetes might also have comorbidities such as high blood pressure, high cholesterol, or maybe overweight. So, importantly, people that are 60 actually, when they have diabetes, cardiovascular disease, this shortens life expectancy by 12 years. So, if you have diabetes, get treated. Metformin is the first line of defense, of course. Very effective for many individuals. However, there is some argument as to when insulin should be started. Some doctors actually recommend that insulin be started more in advance to kind of taper the effect of the disease. Others say that you should try other anti-glycemics, anti-diabetes medications before you move on to insulin. Again, this is a conversation that you would need to have with your physician according to the risk factors and aspects that you want to think about. So here's some questions. I mean, you should be your own advocate. You have to vouch, or somebody that is your caretaker should be able to vouch for you. And these are the questions that you want to ask. What changes can I make as part of my daily life to take care of my heart? How will I know if any of the changes I've made are making a difference? And are there any resources that will help me to learn more? Again, they're open-ended questions. Some of these things you probably can kind of take a look online. There's a lot of places. Of course, some people have coined this Dr. Google, but there's many places that you can actually inform yourself, kind of understand what is going on, and then accordingly compare that to your knowledge and be able to ask the right questions according to the knowledge that you've amassed through the internet. Now, many people, of course, criticize that, but as the internet many places become more and more accurate, and your ability to collect and understand becomes more developed. So if you have a .com or some other places, they might not be reliable. Government places may be reliable. However, sometimes forums and support groups are not as inaccurate as many physicians will tell you, because that is actually going into the experiences of people, even though that may be anecdotal, but you're reading firsthand of people that have possibly taken the medication or gone through the experiences of the disease that doctors might not have. So for instance, a doctor that might not have ever experienced diabetes, when they're treating patients or telling patients about certain side effects, they might not necessarily know the actual experience, whereas people that have diabetes, they may be able to tell you something else. Also, support groups are very important in that respect. And I have attended support group meetings as well. So there is indeed kind of a difference in perspective, but either or both, very important to take note of. Now, again, I went into a tangent, but the main point is to kind of highlight diabetes, physical inactivity, cholesterol, all of these areas, smoking, all of these areas are important to curb or address so that you're not developing cardiovascular disease. Remember, when you have diabetes, cardiovascular disease is actually lowered. Um, it decreases your life expectancy by 12 years. How do you understand your risk CVD risk score? The one that I would recommend is Q risk 2. And then just to keep in mind about health literacy and asking the right questions about your physician, go ahead and do that. And then also add um, be a part of forums so that you can feel like you're in a community, not depressed, and also understand the perspective of people that have gone through similar experiences as you. I hope this has made some sense. Again, happy World Heart Day. World Heart Day. Thank you for listening.